midst as well, and just lift up our mother in our presence, lift up the triune God, and really bless our time together. So I will go ahead and I'll just be walking. I think you can see me. Yes. So just basically to say this is the outline. We're looking at the crisis. So we'll begin with just defining what is health and shalom. So it's always important to be able to start with what it is, what it should be, so that we can always have a reference point to where we're going. And then we're going to look at the crisis, that we are in a crisis of mental and physical health. We are in a crisis, and we need to understand that. And it's a crisis that is affecting, as you will see, from children right throughout, a lifetime. So we'll be looking at that. And then just to say what is mental health and physical health. And I think it's the other way around, but we'll just follow. And then to really come to what is important. So here we have a crisis. Here we are meeting as women of faith. Is there a way in which our faith can operate to enable us to meet the crisis? Because that's so important, because we need to be able to draw on our faith in order to handle the challenges that are around us. So that's where we're going, to say that we understand the crisis, we know what it is, but we believe that with our faith we are able to meet the challenges. So I just wanted to start off with what is health. We're talking about health. So health is not just the absence of disease. So often when somebody thinks I'm healthy, you are saying I'm not sick. So that's a very narrow understanding of health. So let's look at health is a state of complete physical, mental, and social well-being. And it's not just the mere absence of disease. Yes, let's move on. So the enjoyment of the highest attainable standard of health is a fundamental right. So it is a human right. And we know that many times that right is violated. And that's why, we're going to be looking at some of those issues. So we need to just keep that in mind, that when we are talking about health, we are not saying that you are not sick. We are saying, are you fully well? Are you mentally, physically, socially well? That is the ideal of health. And then we move on to shalom. This is a biblical concept that is also related to our faith and our salvation. So Jesus says, I give you my peace. He's saying, I give you my shalom. So what does that mean? It means wellness. It means reconciling with God. And it has a sense of well-being, psychological well-being, spiritual well-being, physical well-being. And so it's going to do with completeness. So we start off with that vision so that we understand that this is the goal. This is the goal of what we want to achieve, that we are healthy, and that this is the goal of our faith, that when we encounter God, we are healthy. So let's move with that. So mental health is a state of mental well-being that enables us to cope with stresses. And I mean, we, after COVID, the mental health parameter went right through the roof because of the stresses that it came with. To realize our abilities to learn, to work well, and to contribute to our communities. Mental health. So we move on to say the 4 components of mental health are emotional well-being. That's where forgiveness comes in. If you are carrying a grudge, you are not emotionally well. There's that sense of toxic presence in our lives. So emotional well-being, psychological well-being, social well-being, that we're able to contribute to our society. We feel like we are part of the community, and also flexibility and ability to address. In COVID, we had all to be flexible because life was just changing just like that. And that's part of the mental health. And that's where the mental health breakdown came on. So we need to go and we look at the mental health crisis. According to the 2022 World mental health report, 970 million people are living with mental disorders. But what is more disturbing is that 14% are young people. Young people. That is what should be disturbing us, dear mothers and sisters. And then if we look at the child's gauge that was just released, it's even more disturbing. Nearly half of the children in South Africa, 42%, have experienced violence, including physical violence and sexual abuse. That's already, that's a very high number of children experiencing this mental health threat. 2/3 of children live in poverty. 10 to 20% of children will develop a mental disorder. 65% of children and adolescents with mental issues do not seek help, and 50% of adult mental health disorders start, when people are younger. So we are seeing the crisis. We are seeing what is happening. That mental health crisis is real. Only 1 out of 10 children with a mental disorder has access to treatment. So that's a social justice issue. Because if you've got a mental health challenge, you should be able to have a support structure there. And then we've got suicide. That is also the ultimate. The ultimate. When somebody feels like, I cannot go on, there's no capacity to think beyond what is going on. And it says that 58% of the suicides occurred before the age of 50. And the 4th highest cause of death amongst 15 to 29-year-olds. We're in a crisis, mothers. 15 to 25 years old committing suicide. What's going on? Where are we? Where is the church? What's going on? And then an estimated 82% of people living with mental disorders are in low and middle income countries. So even poverty and the state of our countries is, all the political situation throughout our continent is creating a mental health crisis. So the data suggests that 1 in 6 are suffering from anxiety, depression, substance abuse. These are all part of the mental, challenges, as the psychopathology, the mental diseases, anxiety, all kinds of disorders. People where all the members feel safe, feel that they belong to somewhere where they can grow in their health. So dear, I'll close with this. Let me close with the text, the 2 texts. People of God, okay. Let's move on to the next one. Yes, I want to close with these two texts where Jesus said, the thief comes only to destroy and kill, but I came that you may have life, and life in abundance, mental, physical, and social health. And then doesn't promise that life will be easy, but life will be difficult, that there is a narrow path, but that if we choose to have faith in those difficult moments, because we turn away from God when we have difficult challenges. But in those difficult moments, those are moments of faith where we can entrust God with our mental and physical health, because those are connected. I have come that you may have shalom, wholeness, life, mental, physical, social. God bless you.